And we're live. Hello, it's Bill, the knee pain guru. Today is Thursday, October 28th, 2021. Let's see, what are we talking about today? Let's see, do we get the notification? Yep, we're live. Okay, today we're going to talk about what to do when knee pain is worse after knee surgery. Yeah, that could be kind of a bummer, thinking that the surgery is actually going to make your knee feel better. And it doesn't, but it happens quite often. So, I have a question that was submitted here. This is from Susan. She said, "Thank you for reading out my comment. I will look into your links. I actually watched a video of a knee transplant, knee replacement surgery, and it's really brutal surgery. I tore my meniscus on both sides using a hoist at work. My manager forced me to use the hoist in a confined space. I had the meniscus trimmed down to the tears, but the pain got worse. My knee would lock and let me down. I had a bad experience after sitting for 40 minutes on transport, and I could not stand up and walk. The pain was horrendous. This went on for hours. My surgeon said I needed a knee replacement at 60, which I had the following month. We went into lockdown, no physio apart from what I did from a leaflet given me in the hospital. Consultations were telephone calls. I saw my surgeon twice in 20 months. I told him about the bend of 10 degrees and pain back of the knee when I was trying to walk up and down stairs. He said, your knee is like a new shoe. It will loosen, and he would see me in 8 months. I live in England. I feel totally let down by him. Returned to work 3 months ago. In care, and I am struggling. Knee swells and hurts, and I struggle to get up from a sitting position. I can walk fine, but not for long distances. It's all about the bend." Okay, common situation, common scenario. We're going to dig into, it looks to be dealing with the range of motion and pain after knee surgery. If you have questions, there's a few people here live. You are welcome to enter in the comments section any questions you have, any comments, whatever situation you're dealing with, whatever you'd like to share. We'll dig into that today. We're going to talk about Susan's situation and break it down, because whenever we have something, Susan's dealing with this pain and range of motion after this knee surgery. Looks to be a knee replacement surgery. So we have to, if we're not getting the results that we want, we have to take a step back to look at what is going on underneath the hood. And when I say underneath the hood, we got to look on a deeper level why the knee doesn't feel like it can be bent. Because if you're trying to bend it and it hurts, that's the body saying, whoa, 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 hold on. I don't want to go in that range of motion. And the pain is there to say it doesn't feel safe, supported, listened to. Now, you may be sitting there going, well, that sounds silly. My knee isn't saying I feel safe, supported, and listened to. But I guarantee you this, if your knee did feel safe, supported, and listened to, it would bend for you. And the reason it's not bending is because there are conditions that are being created either by work, in Susan's case, work, by the doctor, by the physical therapy, by the lack of physical therapy, by what is going on in your life, that your knee is going, we're not going to bend. So we need to understand what we can begin doing to take the steps to create the environment in your knee, in your leg, in your hips, in your lower back, that your body feels safe, supported, and listened to, so the knee will begin to bend more. And we do that, from my approach, by creating comfort in the knee. When we create comfort in the knee becomes comfortable, even if it's just a little bit more than you currently have. Then what happens is the knee relaxes and it loosens up. When it's tense, when it's tight, when it's in pain, when it's afraid, tenses up to protect itself. And it's not going to move. No matter how much you try to push it, no matter how much you try to force it, no matter how much you try to stretch it or strengthen the muscles in the legs, that tension still exists in the knee, and the knee isn't going to go any further. If this makes sense, give the video a thumbs up. Like and subscribe to the channel. Turn on notifications for future videos. If you have questions, please enter those in the live chat or the comments section, and I will be happy to address what's going on. But this is a fundamental, underlying, baseline stuff that's going on, whether you've had a knee surgery or not, whether you've had knee replacement or not, whether you've had an injury or not. There is a range of motion. There is a level of pain that exists in the knee. And until we begin to create that environment so the knee feels safe, supported, and listened to, the range of motion isn't going to change very much. You're going to work really hard. It's going to be very difficult, and you're not going to get a whole lot of results. Why is that? Because we're pushing the rock up the hill. We're going contrary to what your body wants to do. The idea is to understand, how can your body heal? How can we line up what's going on in your knee, your leg, your hips and lower back, the environment that's being created for the knee to heal, and begin to change and tweak and look at that as like this big system. And we make small tweaks and adjustments that begin to set up that foundation. So now your body's going to be able to relax, let go, and recover quicker. Now, how do we do that? We do that by changing the neurological signaling in the knee. What's a neurological signaling? Well, let's look at a fuse box for a house or a car. And when there is too much electricity or something isn't working properly, the fuse box will blow a circuit. It'll blow a fuse. You pull that little fuse out and you'll see a little connection. It's no longer connected anymore. And no matter how many times you flip on and off the light or try to plug into that socket, until you reset the fuse box, power isn't going to be completed in that circuit again. This is what happens in your body when you have an accident, an injury, a surgery, a trauma. Something happens, so a fuse blows, and your body does this workaround. It's not going to go in that range of motion because the fuse is blown. Something in your neurology has changed to move away from the pain and go to a place that's more comfortable. Even though it may be painful, it's still more comfortable than if you were to go in the range of motion that it hurts in. And no matter how much you try to force your knee into that range of motion, you still have the fuse that's blown in a fuse box that doesn't want to be turned back on because it doesn't feel safe, supported, and listened to. So the key is we can reset the fuses in your knee. We can rewire the neurology in your knee by working with the intrinsic movement of your knee joint. Now, intrinsic movement, there's two different ranges of motion in your knee. You have intrinsic movement, you have gross motor movement. Gross motor movement, you're most familiar with. Gross motor movement is your knee extends and it bends. Simple, easy to understand. You extend your leg, you bend your leg. Leg extensions, leg curls, leg raises, those are all gross motor movements in your leg. Intrinsic movements are going to be within the joint itself. So you have the gross motor movement is like this. Intrinsic movement is going to be slight twisting, slight side to side, slight forward and back, slight apart and together, slight tilting of the knee joint. This is what you feel when you're trying to get up out of a car and you don't have the strength in your leg, you don't have the flexibility in your leg, or you don't have the ability to kind of push and twist to the side. This is where I see conventional physical therapy doesn't address, is in the nooks and crannies of how the knee joint works in the intrinsic movement that doesn't allow the knee to feel normal again. So as we create comfort in the knee joint, in the intrinsic range of motion of the knee joint, what ends up happening is we begin to change the neurological signaling. The fuse that was blown as a result of the accident, the injury, the surgery, the trauma, we begin to reset that. So now the knee feels safe, supported, and listened to. The joint relaxes. The range of motion begins to come back in the knee joint. And then the body recovers and heals itself much faster. So the more we can create comfort in the knee, working with that intrinsic movement, the faster we reset the fuse in the knee joint. And now the strength comes back, the mobility comes back, the flexibility comes back. Excuse me. The comfort in your movement returns as a direct result of resetting these neurological signals that were blown as a result of the accident, the injury, the surgery, the trauma. If this is making sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos, tag your friends, family, and loved ones, especially the ones that limp. They'll benefit from this video. If you have questions, whether you're live or you're watching the replay, enter those in the comments section or the live chat, and I will be more than happy to address those. Let's see. What else? Oh, what can you do? What can you do now? Well, these are action steps you can take right below in the description box of this video. You can get on my newsletter list. No cost or obligation. You could begin understanding knee pain from a different perspective. The goal of these videos is to begin to open up a door to give your mind a different way of looking at pain. This is not about solving your pain right here, right now, because it's taken you a while to get to this place. It's going to take a while to get you out of pain. We need to change the way your body functions and operates. We need to change the way your mind thinks about pain. And what we want to do is give your mind different things to focus on that will begin to cultivate a new reality for your experience with your knees and the way you move. This is making sense. Give the video a thumbs up. Forward this video to your friends, family, and loved ones. If you have questions, please enter those in the comments section. I will address those here shortly. Let's see. So you can jump on the newsletter. Here, let me send that. Let's see. Newsletter right there. I also offer consultations. If you'd like to talk about what's going on with your knee, your specific knee situation. I have a consultation link that you can go to. There is also my group and private coaching programs that I offer that give you relief today. We begin to teach you how to get the pressure off of the nerves in the knee that are causing the pain. And when you begin to get the pressure off of the nerves in the knee that are causing the pain, it's very much like pulling a splinter from your finger. You get relief just like that. So you can check those links out below. I have some more questions that I wanted to address. They were coming in. I believe one came in earlier today. Let's see. Okay, this is from, it was a video that I recorded, does knee cartilage heal itself? Knee cartilage heal itself. And the person who wrote in was, the reason I'm here is to enjoy myself. That is the name. That is their account. And it says, I think it's awesome. They write, I think it's awesome. You also include emotions and thoughts. I heard a reflexology therapist saying if one has a left knee problem, it's due to a problem with a man, and a right knee problem, it's due to problems with a woman. Thought that was interesting. Have you ever come across those observations in my career? Yes, I have. Louise Hay, she wrote a book, You Can Heal Your Life, I believe. And she had very much the connection between right side and left side. It was actually opposite. She said the right side is male, left side is female. It can be the case. It's not a hard, fast rule. Well, what I would look into is a lot of times just listening to clients talk about what's going on in their knee, maybe hearing what they have going on in their life. They'll talk about their significant other or children or things like that, and it'll be reflective of what's going on in other areas of their life. Like I have one client that I see in person here in the Asheville area, and she has everything is right side. And the majority of the challenges that she has is with her son. So it's very reflective of all of the conflict that she's having in her life seems to be directly related to what's going on with her son. And now, is that the case? May or may not be. It's an interesting data point. It's not something to completely go into. However, you can observe that and look at situations like that. I had another client who had a lot of stuff going on with the left side of her body. And the more we dug in to what was going on in her life, she had a female boss that was really, it was challenging for her. And that was one of the reasons why the pain in her left knee, when she discovered that and made the connection that the reason why she didn't want to go back to work was because she was on paid leave, and that if she went back to work, if she got over her knee pain, she would be able to go back to work, and had to deal with this female boss. Well, things shifted for her when she made that connection. So, like I said, it's something that you can look into, and it's interesting. However, we don't have to completely rely on that type of or level of information in order to resolve what's going on in the physical body. So it all goes back to the neurological signaling, the source of the pain. If we create comfort in the knee, then the pain begins to dissipate and relieve. So that's what I got for today. I have a little video I'll play for you at the end. Once again, make sure to give the video a thumbs up, like and subscribe to the channel. If you have any questions, leave those in the comments section, and I will answer those on future videos. So this is Bill Paravano, the Knee Pain Guru. Thank you so much for being here. Have a wonderful day. We'll see you on the next one.